Now chopping it up in the red light district.
Let we dance now. Take a chance now with me.
Alright, so tell us a little bit about your practice. First, let me say congratulations.
Thank you.
Congratulations. We haven't spoken in a while, and I was surprised when I heard that you became a doctor. But congrats. So tell us a little bit about your practice.
So my practice is Eternal Dermatology, and we're located in Fulton, Maryland. And I started in 2018. So essentially, I've been in the DC area for about 20 years, and I trained at Howard University, and then I was on faculty there. And after 5.5 years being on faculty, I wanted to try the whole private practice thing. I worked for some other dermatologists, and it was fine, but I felt like, first of all, I wanted to deliver care in my way, and really be able to basically make something my own and make it my baby and just mold it for what I want to do. And that's why I decided, it's better to just do it myself.
Nice. I agree. It's best to have your own.
I mean, that being said, it's a lot of work. I say it's like my fourth kid, right? Because it's a 24-hour job, but nothing is more gratifying than knowing, you call these shots, and you're responsible if something goes wrong, but still, it's all yours.
Yeah, you did it. And how much years now you've had the practice running?
For about 5 years. We celebrated our 5-year anniversary last June, and that was really monumental because as a small business owner, you go in with a certain level of fear. You're wondering, can I really do this? I remember even speaking to my mother when I told her I was going to leave my hospital job and open my own business. She tried to be supportive, but she was also like, this girl crazy or what? But you just put in the work nonstop and it pays off.
Nice. So what services do you offer in your practice?
So it's been a sort of an evolution because we started off basically offering just every type of dermatology, medical dermatology, warts, skin cancer detection, surgeries, cutting out skin cancers, cutting out cysts, and then also doing cosmetic treatments, anti-aging, lasers, laser hair removal. We did everything. We saw adults, kids, the whole range. But as I develop as a business person, and also I speak to my mentors, I read books, I realize I don't want to be a what is this saying? If you do everything but you're master of nothing.
Oh,
Jack of all trades.
Jack of all trades, master
I don't
of
want to
none.
be a jack of all trades, a master of none. So I decided, to really see, who's the population that's seeking me out and trusts me and believes in me, and what do they need and what can I provide to them. Because let's say the doctor-patient relationship is more than just, the medicine of it, but it's the trust. You want to really be able to connect with someone so they can really hear what you're saying. And also let's say when I see a black female and she has dandruff and she's like, I can't wash my hair 3 times a week. While some other dermatologists that don't understand the intricacies of her braids or her locks might make those suggestions, and I understand exactly, what she means. So I'm really able to connect with her and tailor the treatment plan to her lifestyle and her needs. So that being said, over the past year, I've really started to hone in on my specific population. Now, granted, anybody that comes through my doors, they get top tier service and the best care, but in terms of my marketing and the people that I really let know about my services, I really want to be there for skin of color. And we also have a hair and scalp center specifically at Eternal Dermatology to deal with hair loss and scalp disorders, which of course disproportionately affect black people,
right,
essentially. And then actually to take it a step further, I'm coming out with a hair product line that's going to be absolutely amazing. I'm so pumped for it. It's going to come out in the next few months.
Okay.
And it really targets like a niche set of the population whose hair needs have been ignored. And I know you guys probably think that, yeah, black hair care products is a million of them out there. Yes, but still, some of us still, there's still some areas that need a little work, and that's where I'm focusing.
Yeah, and there is a lot of black hair products out there, and, but as people searching for like a quality one.
Well, of course, and that's the thing. Even when I look up some of the products, you see, it's just like random people with no qualifications, no credentials, just coming up with something. And I feel that, you know, with my background using, you know, the science, the actual science of it, using my training and my expertise is just like the perfect combination. So my goal is that, you know, let's say for the busy person or working person, I don't have time to figure out what's the best product to use. They can come to my line and know that it's, you know, that it's safe and secure and tested and effective, so they don't have to do the groundwork themselves. And you know, the reason why I know it's going to be so amazing is because, you know, I had some issues myself that I was looking for a specific product, and I was like on Amazon, I was on Google, and I literally couldn't find the product. And it probably is out there, but I don't think, you know, the marketing is really reaching a certain set of the population for them to know that, hey, this is for you, this is what you need to use versus anything else.
Right. I didn't even know that like hair and scalp issues was a part of dermatology.
Yeah.
I found that out when I decided to do the interview. I was doing my little research. Yeah, I was like, okay.
No,
I didn't know that.
That's a major part of my practice because, again, you know, everybody has hair and scalp issues, but it affects black people so much more because our hair is different. We have different needs, and also just because I think it's probably been a little bit neglected, so the gap is still there the most. So that's a major part of my practice, and you know, a lot of black patients come to me because that's definitely an area where you know, patients feel like somebody who may not have their hair type wouldn't understand, you know, why they can't get it wet, or why even exercising or going to the gym, or why people like wear different hairstyle for carnival, like braids, etc. Because, you know, you can't have your hair blown out or straight on the road.
Why is that though?
Well, because you're gonna sweat. You're gonna sweat it out. In the first hour, it'll be sweated out. It'll be sweated out as soon as you come off the plane, even. You know, so right away.
All right, so I guess that's one suggestion for females during carnival time. What other suggestion you would give them in terms of like their hair care, their skin care?
Well, in terms of hair care, so definitely a protective style. That's not a lot of tension on the scalp, nothing too tight, and definitely something that's get up and go, right? Because if you have a fet, you have to go to 4 o'clock in the morning, you don't really necessarily have a whole bunch of time to get it in order, and you want to be able to go or just do what you want to do without having to think twice about your hair. So that is super important. Okay. Cool. Something else that I really want to emphasize, like every carnival season in February or in the end of January, my schedule at my practice is booked with people wanting to do procedures in preparation for carnival. The biggest piece of advice I can give is you need to come like at least 3 or 4 months in advance. I don't want anyone doing a procedure for the first time 2 weeks before a big event. And whether it's carnival or their wedding or whatever it is, you need to, you know, have that procedure done well in advance. Know how your body's going to react. Know how your skin's going to react. So then when carnival time rolls around, sure, you can come to my office 2 weeks in advance and we can do a touch-up, but it can't be the very first time you're having the procedure done. For a few reasons. You mightn't like how it looks. You might have an allergic reaction, some sort of side effect, and then your entire, you know, event is ruined. So don't ever wait until the last minute. The other thing is, so I had some friends contact me. They had like some dark spots on their legs, which is common, and they wanted to get some chemical peels done to lighten those up for the carnival season. But a lot of the procedures that we do it's a series. So like let's say chemical peels, we say once a month for 3 or 4 months. So yeah, you can do one right before Carnival, but you're not gonna get the maximum benefits. So you really have to plan a good few months in advance,
3 to 4 months.
at least.
What kind of procedures do like people come in for in terms of the skin?
Definitely the chemical peels to help with discoloration, whether it's definitely on the body, but sometimes on the face too, just any sort of dark spots or brown spots. Everyone wants to get that taken care of. I get a lot of people doing Botox. It's just everyone wants to look their very best when they're out on the road. You have your
Right.
costume, everything. Something else that's been really, really useful. I don't know. What do you know about Botox? Much? Or no?
No, not really. I don't know anything about Botox.
People are doing Botox.
So, there's a saying, black don't crack. So sometimes black people feel like some of these things aren't for us because we don't age, as quote unquote poorly as some other people do. But like I have Botox and I love it. It helps to prevent some of the fine lines that set in over time. So like horizontal forehead lines, these number 11 lines.
No, wait.
Yeah. And the Botox basically weakens the muscles so that your skin does not make these movements, but it's temporary. Okay, so it's not permanent. You don't have to think your face is going to be stuck that way.
Filler.
Well, filler even isn't permanent either.
Right.
But the thing about the Botox too, everyone's like, oh, well, am I going to look like those horror stories online? But those people that you see on television that look terrible, they've had tons of Botox and tons of fillers over long periods of time. Like if you come to, like let's say me, my motto is that I want you to look like the best version of yourself. So you're not going to look crazy by getting Botox every few months out of practice. But if it is a little addictive and you feel like you want more, but it's when you get carried away that we get those horror stories.
So there's a limit.
Yeah. So the thing about the Botox, why I think it's so wonderful, is that when, let's say, your face doesn't make these movements specifically for Carnival, it really lets your makeup lay it really helps your makeup to lay smooth and flat on your skin. What you realize, let's say someone that doesn't have Botox, is that throughout the day you're partying, you make facial expressions, your makeup starts to form creases, so your makeup makes lines on your forehead. So it really helps to improve the length of time that your makeup can stay in place and look really good when you don't have all that extra movement.
So for the females, in terms of preparing their skin for like makeup and besides Botox, is there anything else that they could do?
No, in terms of, let's say, preparing your skin, not so much to prepare your skin, but to care for your skin when you have on all that makeup, throughout the entire Carnival season. So this will sound obvious, but, let's say you go off fat, you have a great time, you reach home whatever time, and you're really tired and you want to fall asleep. You know what you have to do first? You have to wash off your makeup. Oh, God. Now you have me mashing up your mic. You have to take off your makeup. Sleeping in your makeup is a surefire way to get a nasty breakout in the middle of your Carnival season. You have to wash it off. And I would even sometimes, recommend there's micellar water. It's like this light astringent that you can take like a cotton pad and wipe your face first, just to remove the bulk of the makeup. And then you can use a gentle cleanser to remove the rest. But you definitely don't want to sleep or stay with it on your face for longer than necessary. I would even say as soon as you get home from work, if you go a day fete, whatever, as soon as you get home, let that be the first thing that you do so your pores can breathe until the next time you're going out.
Is there like any concerns as far as like besides, I guess when you say breakout, you talk about like acne, right?
Yeah, like pimples.
Infections, like skin infections. Is that like a concern too if you don't clear that makeup off your skin?
Well, so we have natural bacteria that live within our pores, and you wouldn't get like a really terrible, let's say, infection, but when the pores are clogged, then that's what makeup does. You know, if you don't remove it, it clogs your pores, and then the bacteria that naturally live in your pores can overgrow, and it becomes inflamed, and you get like these pustule bumps. So it's not quite an infection, but it is bacterially related, and it's inflammation that doesn't look good and can also lead to scarring and discoloration of your skin long term. So it's a lot of things to consider.
That does not sound too pleasant. So how much Caribbean people do you see like come into your practice?
I would say, you know, I see quite a few Caribbean people, and it's funny because Instagram is my main source of, you know, reaching the community right now, and you know, a lot of people see my videos, and I get a lot of comments, "Are you Trini?" or they just put the Trini flag up there, and then they find me. So, you know, people, I guess, want to be seen by someone that they know understands, again, their culture, and understands, let's say, how important it is that they look good for Carnival. So yeah, I get a lot of people too that come for injectable dermal fillers, and that's essentially collagen or hyaluronic acid in a syringe that we can inject. You know, and some people do it just to replace small amounts of volume that are lost in their face. Other people want to really you know, have facial contouring, like sharpen their jawline or elevate their cheekbones. So it's a lot of different, you know, people have different.
To touch on that, let me ask you a question. How do you feel about collagen creams or collagen serum to help, you know, reduce aging lines? A lot of women, they see a lot of these products, and how effective are they?
Right.
And what is your recommendation in terms of using these products? Because I feel like a lot of women aren't sure about how the effects of these products over time.
Right.
You know, a lot of collagen in your skin. You know, how does that affect your skin over time?
So the main products that people use to help with the tightness and firmness of the skin are hyaluronic acid serums, and hyaluronic acid is one of the building blocks of collagen in your skin. Now the thing is that the hyaluronic acid molecule is a large molecule, so it doesn't actually penetrate through your skin. So let's say those hyaluronic acid serums, they sit on top of your skin, and hyaluronic acid is great because it draws a lot of water into the molecule. So when you put it on, your skin will look plump and moist and youthful, and for that reason it's great. But because it doesn't penetrate into your skin, it's not giving any long-lasting anti-aging effects. So I do recommend hyaluronic acid serums. I think people love it. It's great. Your skin looks good, but it's not part of your long-term regimen. What I recommend really for anti-aging is retinol serums, and retinols are these products that actually change the way your skin cells develop from the inside out. So they unclog, picture it like turning over the cell layers and then sloughing off the skin. So they unclog the pores, they help with acne, and they also help a lot with discoloration, because when you have discolored skin, it's just like the discolored skin on the surface. And as the retinols speed up the cell turnover, it sloughs off the dead discolored skin to reveal fresh, new, healthy, even skin beneath. So that's how the retinols work, and that's why that's like a mainstay of, basically it should be, of everyone's skincare routine. The hyaluronic acid serums, like as I said, it'll make you feel great. Your skin will look good when you're using it, but when you're not using it, your skin's right back to normal. So that's the disclaimer on that. The one thing I really, really love is vitamin C. Okay, and I recommend that basically all my patients use a vitamin C serum every morning. It stays in your skin for about 24 hours, so you don't need to use it twice a day. You can just use it once, just a few drops to the entire face. vitamin C is an antioxidant. So the way it works is that it prevents oxidative damage from environmental pollutants and DNA damage from sun exposure. So that's one of the things I think can really keep your skin glowing and youthful.
Any particular brand your favor with the vitamin C?
So, you know, the like godfather of vitamin C is by a brand called SkinCeuticals, and it's called specifically CE Ferulic, and that's because it has vitamin C and vitamins E in it, and also ferulic acid, which is an agent that helps stabilize the vitamin C molecule. So a quick tip that I think is super important is that I don't ever recommend, personally, I do not recommend those over-the-counter vitamin C serums that you can get like just in the regular pharmacy, because the vitamin C molecule is very unstable. So basically it's degraded by the time you're using it. So that's why I vouch by the SkinCeuticals brand, because that one has been tested. It's in a dark bottle, which keeps the molecule more stable, and again the ferulic acid helps to stabilize it as well. So at least you're getting the maximum benefit.
All right, so people with skin allergies, in terms of like the whole carnival season, being in the sun and the makeup and putting like the temporary tattoos on the skin, you have any advice for them?
So the bottom line is the same as I've said before, which is don't try anything new for the first time. So even if it's a temporary tattoo, I mean, get a second one and do a trial run, whether it's a month or two before the actual season. But you never know what you're allergic to till you have a reaction, right? And you don't want that to ruin your good time. Right. So that would be the most important thing. Like, don't try anything new, whether it's your makeup, your skincare products, the tattoos, your lotions, even some fabrics that in contact with your skin can cause itching or sensitivity. Whatever it is, you want to try it out before, so you know that in the actual moment you'll be comfortable and confident.
All right. So don't want the men to feel left out. Is there anything different that men should be doing as opposed to women?
What should men be doing differently?
Hey.
That could be useful too. I would say, it's just all about self-care. Self-care. And again, okay, fine. If you're going to be waxing your chest because you want to be all smooth, on the road, again, don't do it right before the season. Try it out first, because something we see commonly, especially in people with curly hair, is when the hair starts to grow back, it can cause little, essentially, razor bumps, and that could occur on your chest, on your bikini line, and for both men and women, but especially women, right? When you're in your cute, kind of a costume, you don't want to have bumps and hairs in that area. So do everything long in advance, and then let's say if you're gonna wax, do it right before carnival, so that it's fresh and clean and you don't have regrowth in those first couple of days.
I mean, I feel like men, as a man, you have a manscaped routine, right? Like if you into self-care,
but that's the problem. Some men that are not into self-care may choose to step up their game for the carnival season.
I mean, I manscape. I shave my underarms. I'm a very hairy person, so I shave my chest hair. I shave a lot of my body hair down to a more manageable, So even stuff like, when the hair regrows, knowing, okay, you might have a breakout or something like that. Your skin, right? But I guess a lot of younger men may not.
But you brought up a very, very important point there, and that is hair removal. Now, that is one of the key things that everybody, men and women alike, need to do for the whole season, because you don't want the wrong hairs growing out to the wrong places at the wrong time. And for that, I always recommend laser hair reduction specifically. And notice I said laser hair reduction, right? Everybody thinks of the phrase as laser hair removal, but really and truly, it's really only permanently gone when you have lighter skin types, like white skin. Let's say in black skin or dark skin like mine, it's never permanent. Okay, So I usually recommend, I say for my patients, we do a series of 6 treatments spaced a month apart. So that shows you how long in advance you should, kind of be prepared. And then after the 6 months of treatments, you can do a touch-up treatment like as needed, because over time the hairs slowly grow back. They first appear as fine, thin hairs, and then they get longer and thicker, and then you can just treat it as needed. But instead of having to, whether you're man or woman, landscape your chest, armpits, the bikini line, whatever, if you get on board and get your laser done in advance, then you have a really seamless experience. Because something else I know that happens with a lot of people is when you whether it's shave or wax, you might shave or wax today and the hair start creeping out 2 days later.
Yeah, I mean,
and you don't
shave your head, you shave your head, in a couple hours.
Yeah, a couple hours it's already.
But
coming
that's
back.
one of my biggest populations for laser hair reduction is men who, have lost all the hair on the top and they're not really trying to have it on the sides and the back. So we do laser to the full scalp so they can get a nice, smooth, shiny, scalp that's not growing back in 2 days.
So as you talk about that, how you have like the some men have the dark area here and on top is lighter where they're balding. Is that because of the hair? That's still there?
Essentially, yes, because the hairs, they get little hair bumps in those areas too. And even when you do, which the hair bumps lead to the discoloration, we call it post-inflammatory hyperpigmentation, which basically means that the hairs growing out of the skin cause the bumps, which it's linked to inflammation, and then it leaves a dark spot, especially in brown skin. That's how our skin reacts to inflammation, by leaving a dark spot. But also, just the shaving process of the razor and the friction against the skin repeatedly over days and years leaves that dark shadow. So men get it, on the sides and back of their scalp. They can get it on the chin and beard area, even women, and a lot of women too on the bikini line. I don't know how closely you might look at it, but you see that dark shadow, and I don't know what you think it is, but sometimes it's not actually hair. It's just the inflammation and the darkness that results. So that's one of the main reasons too that I perform laser hair reduction on a bunch of my patients that have those hairs, and we often follow it on like same day with a chemical peel onto the skin. So the laser removes the hair and then the peel turns over the cell layers to address the discoloration or dark spots.
What kind of wear does that do to the skin though? Those 2 procedures, is it trauma on the skin?
It isn't, and we're gonna get into the science here. So the way that the laser works is that the laser energy is light energy, and the brown pigment within your hairs attract the laser energy beneath the skin. The hairs are under the skin, right? It attracts the laser energy, and then the hairs explode and then seal the hair follicles shut to prevent new hair regrowth. But the beauty of lasers, when done correctly, is that it bypasses the top layer of the skin. So you don't actually get any trauma to the surface. All the trauma is within the hair follicles beneath the skin. And then the way that the chemical peels work, it's like alpha and beta hydroxy acids that break up the bonds between the cell surface layers, so that your skin cells, which turn over naturally on their own, your skin cells turn over every 6 weeks, the peel just helps them to turn over more quickly. So it reveals, fresh new skin. So it's actually helpful to your skin. And then, on a real basic science level too, the peels help to stimulate types 1 and 7 collagen, specifically deeper in your skin, which makes it tighter and firmer and more youthful too. So I would dare to say those 2 procedures in combination help to strengthen your skin more than anything else. Yeah. But that being said, you can't overdo it. Anything done too frequently will be harmful. But with the peels and the lasers too, I usually recommend spacing it about a month apart.
So touching a little bit on the carnival again, as far as I guess for both men and women, being out there for all those hours jumping up in the hot sun under the blazing sun, what do you recommend for that specific time?
So the most important thing is using your moisturizer with SPF, sun protection factor. don't quote me on that. I don't know if it's protective or protection, but the most important thing is using your moisturizer with SPF, and we recommend at least SPF 30. Okay, but the real key, and this is where everybody screws up, okay, you have to reapply it throughout the day. Right. If you put it on in the morning only, you're probably covered for 2 hours. Okay, what I tell my patients is reapply every 2 hours. But if you're at the beach or the pool or sweating, you have to reapply every 40 minutes. So if you're out on the road and you're in the, and I understand that might be completely practical, but the whole point is the more you can reapply, the better. But don't think that you're going to put on sunscreen in the morning and be good for the whole day, because you're not.
So people have been doing the beach wrong for years then.
Yeah,
the beach,
exactly.
And you should reply every 14 minutes. Nobody's doing
Nobody's
that.
doing that.
It's as impractical as it could be. Right?
And nobody's doing that. That's
Right.
true. And fortunately, people with brown skin have extra melanin and protection from the sun. Okay, so we as dermatologists, we still want to emphasize the importance of it. While we understand it may not necessarily be practical for everyone, but if you have your sunscreen with you, we want you to at least think twice and try to reapply it as much as possible, and just know that after a certain point you're on your own until you reapply. Now, one thing that's actually super useful, there's a brand, Skin Better Science, that has a compact, don't even quote me on this because I can't remember, but basically some skincare lines have like a makeup brush. Okay, so it's like a brush on foundation powder that you can reapply throughout the day. It's really easy to carry and it's light, so it wouldn't ruin your makeup. Is just like another layer on top of it. So that's something that you can look into, because of course if it's a cream moisturizer with SPF and you have on a ton of makeup, contouring, etc., the cream could be a little difficult.
That's some good information there. I learned a lot just in this little bit of time we were sitting there talking.
There are medications.
So there are some medications actually that make your skin more sensitive to the sun, and these individuals, more than anyone else, needs to be even more careful about sun protection. So there's never too much sun protection, but with respect to, let's say, makeup and those other things, medication shouldn't be a problem.